One of the things I wanted to bring to laser dentistry is to talk a little bit about a gradual continuum of learning. Traditionally, lasers are taught in a one-day course where what you do is you hit the individual with a full gamut of procedures. And what unfortunately happens so often is that by the time that you've had the first hour procedures go by, you're numb. And you can't remember the settings, you are having difficulty trying to determine which procedures you would or wouldn't do. So what I've tried to do is take the 21 FDA cleared procedures that are for AMD lasers and break them down into a entry-level, intermediate, and advanced procedure. The procedure levels are a method for giving you training and getting you to handle the learning curve in chunks as opposed to getting all this information at once. Many of the doctors I talk to say, you know what, Glenn, what I really want to do, I want to do a little bit of gingivectomies, I want to take cord out of my practice, I want to treat a few aphthous ulcers, and maybe I want to do some implant uncovering, and if I get a chance and I see real thick frenum, I'd like to do one, but I'm not so sure I can. That's fine. Learn those procedures first, and once you get comfortable, maybe then you start going and progressing towards more difficult procedures. There's a fear. Dentists will purchase a laser, they don't want to use it until they've worked on hot dog or worked on pig's jaw. So there's a fear there of where to start. And what I'm going to tell you is some of these procedures we're going to go into will give you an introductory lesson towards how to use your laser. I get asked about settings. Tell me the setting, tell me the setting. There is no one setting. There's a range of settings. I can tell you if the tissue is very thick, if it's very fibrotic, you're going to have to use a much higher setting than if the tissue is thin and quite a lot of if it's thin and hemostasis could be a problem, that tissue cuts easier than if it's thick and fibrotic. So when we look at these procedures, I group them into entry-level green, intermediate yellow, and advanced and red. And the concept is to allow you to grow into learning gradually more difficult procedures and to warn you of some of the procedures that can be more difficult. The learning curve is dictated by the fact that the laser is end cutting. All lasers are end cutting, and that the interaction is photothermal. So the light that you have emitting from the laser is concentrated in the tip that's initiated, the concentrated the hot tip effect, and you need to learn how to use that laser to cut. And so there is a learning curve that's with that. So when you look at these procedures, things like fibroma removal, gingival troughing, gingivectomy, gingivoplasty, incision and drainage for an abscess, soft tissue crown lengthening in combination with veneers, treatment of canker sores, herpetic lesions, aphthous ulcers, those are all things that can be done fairly routinely. And many people may just stay at this point. They say, oh, I use my laser, but I use it for gingivectomies, I use it for in combination with my veneers, and I treat some canker sores, and I get the odd fibroma that instead of watching, I cut it off, and that's where they'll stop. Some will progress, and they'll start doing things like more exposure of unerupted teeth where the tissue is thicker, or excisional and incisional biopsies where they're sending the biopsies off for treatment. Frenectomies or frenotomies, gingival incisions and excisions, pulpotomies or reduction of gingival hypertrophy are things that are probably of an intermediate level because the tissue is thicker, because there's a concern over the possibility of creating damage. And so you're building up into an intermediate level of difficulty. And finally, the advanced procedures, things like hemostasis can take a long time. You got to use a non-initiated tip, you have to use it for 4 or 5 minutes, and sometimes that is more of an advanced procedure, higher energy settings. Implant recovery, the tissue is fairly thick, so again, sometimes you'll want to use a much higher setting, and you have to be careful around implants where you can have a negative effect with bone. Leukoplakia is something where I really strongly ask you, should you be using a laser to obliterate leukoplakia, and is a diode laser the best wavelength for that? I'm not so sure it is, and I would say that you might be better off to refer that to a specialist unless you're extremely comfortable with using the laser, because I'm not so sure the diode wavelength is best for that, even though it's FDA approved. Lingual tongue tie release is one of the things that relapses with great regularity. Patients don't want to actively move their tongue around, and the relapse can happen. So this is a procedure that is not that easy. Operculectomy, the tissue is thick, it's fibrotic, you have to use higher energies, and there's a fair amount of tissue that you have to cut there. And vestibuloplasty is something where you're making a large incision, and those are difficult procedures. So I again would try and emphasize in the beginning, do something in the posterior of the mouth that is in the entry level and get some confidence in using your laser before you start to build up into these more difficult procedures. Obviously, the higher the power required, the more difficult the procedure and the more problems that can happen. If you're doing an aphthous ulcer at 1/2 watt where there's very little chance of having any laser tissue interaction except hypothermia, you'll find that that's much less risky than if you're using 3 or 4 or 5 watts to get through to an implant and uncovering that tissue. The second thing is the size of the laser tissue interaction. If you have a small amount of tissue underneath a class 5 amalgam, that's simpler to do than a centimeter fibroma that you have to remove that's very thick. The thickness and nature of the tissue. Fibrotic tissue is harder to cut. It's white in color, doesn't have as much pigment in it, so it's not as easy to cut, and so that's more difficult, requires higher energy than if the tissue is very thin and not fibrotic. If it's thin and it's got some color to it, it's easier to cut. The potential for negative sequelae. If you're, again, working around an implant and you have to be careful with the amount of bone that's involved there and you don't want to generate too much heat, that has potential for negative sequelae that is far higher than if you're doing an aphthous ulcer. The number of instances where a procedure is encountered. You may find that you'll have a laser for a year or 2 years, and the first time that you'll encounter perhaps a leukoplakia, or as opposed to an aphthous ulcer, which you might encounter quite frequently. Gingivectomies are something you'll do routinely in your practice. So the levels of difficulty are based on some of those things. I came up with a cookbook of settings that's available from glenvanass@mac.com for a variety of different procedures with the Picasso, and you can see that there are entry-level procedures in that are good procedures for somebody just getting their laser. Things like gingival troughing, crown troughing, tissue management, gingivectomy, soft tissue crown lengthening, treatment of canker sores, any oral lesions, the fibroma removal, incision and drainage of abscess are all things that are entry level, and I would encourage you to look at when you first get your laser. Again, these procedures are all green in color, and they are simple procedures and things that you can routinely use your laser for, and with the comfort of knowing that you're not going to have a lot of negative sequelae. Intermediate level procedures are becoming a little bit more difficult. Things like pulpotomy as an adjunct to root canal therapy, gingival incisions and excisions are maybe require a little bit higher energy. Oral papillectomies and frenectomies and fronotomies are more difficult procedures. They're a bigger wound in the frenectomy, and you may find that it's not something that you want to start initially. Just get comfortable with doing gingivectomies and crown troughing first. Biopsies are again something that people shy away from. Reduction of gingival hypertrophy is number of teeth is also increased, and then using a laser for exposing unerupted teeth, particularly if the tissue is thick, can be of an intermediate level. These are in yellow, and again there's more settings there for you. And finally, the operculectomy, implant recovery, hemostasis after extractions, lingual tongue tie releases, leukoplakia, vestibuloplasty are procedures that I would call advanced. And these are things that you may want to encounter when you've had the laser for a while. One of the things in this list is that a number of people will say, oh, there's implant recovery and I want to use the lasers for implants. I would just say that you have to be cautious with your settings. The tissue is thick. Takes a little while to cut through, and there was a study of using lasers with diode lasers with implants and showed that it was safe around bone at 0.6 watts, but that's a very low setting. It takes a long time with 0.6 watts to cut through. So I would encourage you, if you're going to use higher settings, to periodically stop, let the tissue cool, either use pulsed mode or use a water spray on the tissue to keep it cool. Implants can be thick, the tissue can be thick to remove, and you have to be a little cautious when you're doing implant recovery.